now we're going to be doing a manual muscle test assessment for the jaw muscles. So the first ones that we're going to start with are masseter and temporalis. So those are the closing muscles for the jaw. So for this one, we can palpate that masseter muscle belly, and all we're going to cue the patient is, can you try closing your teeth together or clenching your teeth together? And what you're feeling for is that symmetry side to side of the muscle activation as well as muscle timing. Then we can also, for the same movement, come up onto temporalis and do it again. Feeling for the same thing. We can also come around to the front and apply a little bit of resistance to that movement. So if you just open your mouth gently, yep, and then close. Good. And then she's just kind of isometrically resisting I'm isometrically resisting her closing. So just try closing your teeth together. Good, and then relax. So this one's a little bit more tricky to come around and palpate, but you can be either supporting the cervical spine or you can actually be palpating one side and then the other. Same as for temporalis. So the next one that we're going to do in this position is lateral pterygoids. So lateral pterygoids are a side-to-side jaw mover, but when they work together, they protrude the jaw. So that's how we're going to be assessing this one. First thing is just supporting that cervical spine, and I just want you to protrude, or poke your jaw forward, good, and then come back. And then you can be applying that little bit of resistance on that front of the mandible, good, and then back. And again. Good, and then back. With that one, you can also be palpating in through lateral pterygoids as she's protruding. So if you just open up, good. So you're sliding up along those back teeth towards the ear, and then just poking your teeth forward. Good, and then back. So try forward, not to the side. Yeah, and then back. Good, and protrude. Good, and then back. The last muscle group that we're going to do an assessment for is the suprahyoid muscles. So these muscles sit under that chin and they actively open the jaw. So for this one, we're just going to be palpating under that chin into the soft part. And then if you can push your front teeth up against, your tongue up against your front teeth. Good, and then relax. And again. Perfect. So you should feel that depress around that area. And to resist it, we're just going to apply a little bit of resistance onto the hyoid bone. So try it again.